Good afternoon, and thank you for joining us once again. We continue to appreciate the media getting out our message. It's very important at this time. By now, we should all be aware that the Maine CDC has declared that Penobscot County has community spread of the coronavirus COVID-19. That joins now Cumberland and York counties where community spread is out there. Once again, I just want to caution people as they look at the low numbers of cases being reported by the state. That is due to a lack of testing and not because our overall numbers are so low that we don't need to continue the great advice of staying at home, practicing good social distancing, washing our hands and surfaces frequently, and practicing good cough and sneeze hygiene. It's incredibly important that we continue to do that. Here at the medical center and around our Northern Light facilities, we continue to make sure that we keep our staff and our patients and visitors safe, using the most appropriate protective equipment as our supply chains allow us to, and we continue to evaluate that on a regular basis. As we have always done, we put the importance of infection control and prevention foremost in our hospitals and our other healthcare facilities, making sure that we are keeping our patients safe, making sure that we are disinfecting like we always do, and preparing ourselves for when this crisis is over and we can go back to much more normal activities. I did want to say, because we get a lot of questions about our telehealth program and the fact that we use Zoom to do most of our telehealth visits. There's some concern out there that Zoom is a non-secure form of media. However, the Zoom that we use is what we call HIPAA compliance. And HIPAA is the law that protects patients' privacy. We value our patients' privacy and respect it, and we'll do everything we can to protect that privacy. And the Zoom that we use actually is compliant to keep that privacy. The mechanism that we use means that the patient has to have the code to get in, and they must be invited in by the provider who does the actual telehealth visit. And that ensures that the only people that can be in that telehealth virtual room are the provider and the patient. And now I'll turn it over to Paul Bolin for some more comments.
Thanks, Dr. Jarvis. Part of our approach in supporting our employees throughout this crisis has been to be creative in ways to do that, whether it be through virtual support groups and other means, enhancing short-term disability to employees who did not have it prior, and other creative alternatives. We're continuing to do that, continuing to focus on our workforce, to lean in to support them as they are doing such great work on the front lines, caring for our community. We all need to support one another, and we're going to continue to be creative in our approaches and how we do that.
Okay, now we'll move on to questions. I'll call on each media organization and I'll unmute you. You'll have a chance to ask your question. Please direct your question to either Paul or Dr. Jarvis if you know who might be best to answer your question. I'd like to limit questions to 2 from each media organization today in order to make sure that everyone has a chance to ask their question. The order that we'll go in is Morning Sentinel, News Center Maine, Ellsworth American, WABI, and Penobscot Bay Press. So we'll get started with Amy Calder, Morning Sentinel.
Yes.
Where's yours?
Thank you. Dr. Jarvis and Mr. Bolin, I had a couple of questions. Can you tell me how many, I'm in Waterville, by the way. Can you tell me how many COVID-19 cases have been at Northern Light Inland Hospital? How many have been all together, and how many are there now?
So
and how many also are at the Continuing Care Lakewood?
So we continue to report our numbers out as a system rather than by hospital, and the value behind that is because our numbers are low, we don't want to compromise any patient's privacy. And so currently we believe we have approximately 10 patients across all of our Northern Light facilities, which includes our 10 hospitals and the long-term care facilities that we have associations with.
Any deaths to report?
We have had a few deaths, yes. I can't say that number again. That number isn't changing, and then also it's been over a period of time.
Okay, thank you.
Next we have Bob Evans, New Center, Maine.
Good afternoon, gentlemen. Dr. Jarvis, you mentioned that you had 10 patients within the system, but you also referred that that number is most likely higher. Do you have an educated guess or a percentage of how much higher that number actually is in Penobscot County?
So I will say that the 10 cases that I just mentioned are across all of Northern Lights, so that covers most of the state with our 10 facilities and plus our long-term care facilities as well. I'm quite confident that that is an accurate number for the number of patients who are positive within our facilities, because remember, we are testing individuals who need to be hospitalized, and so I am confident that that number is accurate and that our numbers of patients needing to be in our hospitals has been low. As far as across Penobscot County or across the state, it is hard for us to know that number for sure, because again, for the most part, we are only testing those tier 1 individuals who are sick enough to require hospitalization, healthcare workers and first responders, and then those that are living in congregate living situations like long-term care facilities, group homes, shelters, and the like. We have seen those numbers in long-term care facilities increasing across the state, and that is concerning to us. But it should just serve as a reminder that the virus is out in our community, and we need to continue to do good social distancing, staying at home. Wearing a mask has been recommended by the CDC, and a cloth mask is fine for out in public, different than the masks that we use for healthcare workers. And then, like I said, good hand washing, good cleaning of surfaces that you share with other individuals, cough and sneeze etiquette, the same kind of advice that we give you when we have influenza season as well.
Okay. And my other question is for Mr. Boland. I'll let the camera get set up. But the question is, you had mentioned that to keep staff, if many members of your staff currently employed and stuff, you are moving people around a bit to accommodate current needs. How are you ensuring that staff that moves around is not carrying the potential virus with them from location to location?
So we have syndromic surveillance that we're conducting with employees in terms of each employee at each shift is asked if they have new or changing cough, fever, or other symptoms that might be COVID related. And if any of those are true, then they're directed to speak to a provider or a nurse triage line to identify if they require further testing or evaluation. In addition, we have a universal masking policy in place where employees, if they're within 6 feet of any person, need to be wearing a mask to protect themselves and the folks around them. So that, along with our hand hygiene and other approaches, continue to be the best social distancing techniques and clinical advice we have on an ongoing basis. And as we reassign employees, we're not generally rotating people around large areas or large numbers of areas, but where employees are in a position that might be reduced in terms of workload, we are offering alternatives in other areas. And typically when employees go to another area for reassignment, they stay there for some length of time throughout the COVID crisis. So it's not generally very short instances of working in one area than another. It's typically being reassigned to something that's needed for patient care or other operational needs. And generally employees would stay there throughout the duration of the COVID crisis.
Okay, next up we have Ellsworth American, Kate Koff. The floor is yours.
Thank you very much to both of you for doing this. My first, I think both questions are likely directed at both of you, so I apologize. But my first question is, can you talk a little bit about what the trend line for hospitalizations looks like for the system as a whole? And then my second question is, can you give us an idea of the costs associated with treating a critical COVID patient and who might pay for that care if a patient doesn't have insurance?
So I'll answer the second one first. It has always been Northern Light's policy that we will care for those who need care, regardless of ability to pay, insurance status, or whatnot. And so right now we are not focused on that aspect of the care. It is providing the care that is most important to us. We do keep track of the resources that we need to utilize, including staff time, in response to the COVID crisis as a separate entity than our normal business, and we are still open for normal business. And so that's really where that goes. As far as the trend line goes, and we have started to see an increase in cases across the state of Maine for COVID-19, not just in our hospitalization, but also in our long-term care facilities. So we do know that the numbers are going up. They seem to be going up more slowly than we would have anticipated by some of our early predictive models, but they are following our predictive models that have been in place for the last few days. Northern Light Health is proud to work with the state of Maine on some predictive models for the entire state, and particularly for those regions that are served by Northern Light. And we are encouraged, but we are not stopping being in that crisis mode and setting up to be prepared that in case the numbers start to jump up alarmingly fast, that we are ready and able to care for our communities.
Thank you.
Hey, do you have another question?
Oh, that was both of them.
Oh, okay, great.
Yeah.
Thank you, Kate.
All right, so next we're going to go to Leslie from the Penobscot Bay Press, but before we do, I wanted to mention that looks like we have a little bit of extra time today, so if anyone does want an additional question, just let me know in the chat, and it looks like we'll be able to get through some of those if anyone has any additional follow-up questions. So Leslie, you're next.
Thank you. My question is for Dr. Jarvis. I'm wondering if you see any possibility of ramping up testing for people beyond the Tier 1 patients in the next month or so.
So we discuss that on a daily basis. Sometimes we discuss it on an hourly basis. We wish that we could test more individuals for a number of reasons. One, because I think the general population would like to know what the spread is. For us as being both physicians, scientists, and epidemiologists, that is important data for us to know, to be able to have the proper resources and know where those resources are needed. But unfortunately, the reagents to do testing are very limited in supply. We have expanded out some of our testing in a very limited fashion when we think that it would make good clinical sense, or that it helps to protect a particular population like those in the long-term care facility, or helps to reduce the need for that very, very precious PPE or personal protective equipment. So we are hopeful that we will start seeing an increase in the amount of testing we can do, but only time will tell.
Thank you. My second question is, how are you doing on PPE?
So right now we certainly have adequate stores for the amount of care that we are providing right now. Again, something that we track very, very carefully. In fact, this morning had a wonderful presentation by our supply chain folks on where we are currently, where our projections would be if we were to change our policies, and have an increase in the number of patients here, and where we can expect to see future supplies brought to us. I will tell you, it was encouraging that we think that we will weather this very well. However, at the same time, there is some amount of concern that if our supply chain was to stop abruptly, or if some other factor happened, or if we had more widespread disease than any of these predictive models are saying, that we could be in short supply. We're, again, hopeful that that won't happen, but trying to prepare for the worst.
Since we do have a smaller group today, for time, and that additional questions, I'll unmute you, ask if you have a question, and if you do, you can ask it, and if not, just let me know, and we'll keep moving on. So Amy Calder, Morning Sentinel, any additional questions?
Yes, I would just like to ask if you're continuing the testing in Waterville on KMD, and can you say how many people have gone through that testing site?
I don't know the exact numbers, but Northern Lights assessment sites are still open and running, and so we have them at most of our facilities. Many of them have now converted to not only doing the swab and then sending that test to the lab, but also doing some on-site assessment for individuals who have symptoms to address whether or not this is something that may be suspicious for COVID-19 or maybe part of their chronic health conditions like COPD or other lung diseases. And so we continue to do that at all of our sites. And at varying times they can be busy, and at varying times they can be slow. It just depends on the population, much like our emergency departments and our offices.
Thank you.
Evans, any question?
Brief one, and it can be for either one of them. That is, if one of a staff member is tested, are they taking it out of off the job immediately and pending the test results? And how long is that usually happening?
So this is Paul. I can respond to that. If there's a number of questions, there's an algorithm, essentially a clinical algorithm, that our infectious disease and infection prevention and control clinical staff identified in accordance with the CDC. And so if an employee exhibits symptoms and warrants testing, based upon any known or suspected exposures and a number of other questions, that will determine if the employee is removed for self-isolation or not. Generally speaking, once it's determined that an employee is in need of testing, we're able to get those results back in a fairly prompt fashion, and so there's not an extended period of self-isolation as you would have seen a few weeks prior before more testing availability. So now that we have quicker responsiveness and quicker test results, we're able to determine who needs a test more quickly and get those results more quickly, so it's much less disruptive to patient care needs. If the employee does test negative, they're able to resume their working in a much more rapid pace.
Thank you.
Kate, Ellsworth American, do you have an additional question?
Yeah, I'll ask one more here. We have been getting some questions from folks who are wondering what people have recovered can maybe do to help, if anything. So I'm wondering if you would like to say anything about that.
So yeah, one thing they can do is share their story, and so letting people know that that one, they recovered, so that we're not just talking about people who died, though that obviously is incredibly important, particularly to those families. But I think reinforcing again that most individuals who do get infected with COVID-19 do have mild to moderate symptoms and recover, and so I think that's important. Right now, Northern Light is not pursuing and is not involved in any clinical trials that would involve individuals who have recovered. However, we are looking into those opportunities, and if and when we are able to participate in any clinical trial that would involve individuals who have recovered from COVID-19, we will certainly be finding a way to reach out to those individuals, and if there are those who want to volunteer for such studies, that would be appreciative.